one of the competencies that one say describe the infection types, doses, side effects, indications, and complications of drugs acting on CNS. So in this session, we're talking about all night on Parkinsonism and on and if there are any questions about brains, you can get back to me. Yeah, I think I hope I can answer this question of sorry. She will have been running. So let's begin with drugs in Parkinson's disease. So when we talk about Parkinson's disease, let's talk about what exactly Parkinson's disease is. So most of us know that Parkinson's is due to a deficiency of dopamine in the substantial and in the brain. And always see that this preferred now, when we talk about the normal situation out here, there is a balance between these two drugs, dopamine and pesticides. If there is deficiency of dopamine, or let's say excess of pesticides, this leads to symptoms of Parkinson's. If there is excess of dopamine and lesser of this particular right, it leads to a disease that is Antiparkinsonian disease. So let's start with our basic concept of Parkinson's disease. The same thing. So whatever is the of Parkinson's. So can we make some predictions that Parkinsonism is a disease where the patient has tremors, where the patient has bradycardia and so walk out there and play out there is a patient with the first position. This is tremors and resting, and patient is unable to perform his daily activities. So let's talk about this. What exactly am I talking about? This is characterized by tremor and hypertension. Then there are a plethora of conditions which are function here, mouse-like cases, spinal and depression. Most of these patients who have manifestations of Parkinson, their death is due to either chest infection or cancer. And we have already been talking about this in the presentation right now. Mostly it is pathetic, but there are other causes that are given, which could be arterial disease, or toxins such as stands for antiparkinsonian drugs, which under the influence of the enzyme is converted to anti, which oxidative stress and leads to substantial depletion of the body, the substantial life. And obviously, then there are drugs which act as an antagonist, and to name a few of them, we have antipsychotic drugs and the drugs that are antiemetics, such as cannabis, and which is implicated as one of the for drug use. So what should be the strategy for treatment for patients with Parkinson's? We have already been talking about a balance. One is dopamine, that's a type of deficiency of dopamine. So that means either you can use this or this. So the strategy means that it either increase the dopamine transmission or decrease the acetylcholine transmission. Right. So based upon this, we have what class of drugs that are antiparkinsonian. One is drugs acting on the dopaminergic system, and the second one is drugs that act on the precholinergic system. So drugs acting on the dopaminergic system obviously the first and foremost part, which is followed by peripheral decarboxylase, such as glyceride. Then we have dopaminergic agonist. These are further subdivided adverse and non-adverse derivatives. We have two of them in bromocriptine, phenolide, targeted spectrum. Then we have the molecular inhibitors, molecular and classically. We have the COX inhibitors, which and dopamine, and you have dopamine facilitators, such as then you have these great anticholinergic drugs, the example generally anticholinergic drugs such as primarily, and then you have the various antihistamines such as often and see. Now this our main focus is on the dopaminergic receptors. So there are two set of dopaminergic receptors that are there, the D1 type and the D type. The D1 has two further subtypes which are secretly at the end of biology protein receptor by increasing cycling and two that one and five, whereas the D2 receptors are inhibitory type, they tend to decrease their time like receptor and connection level, where D2 and so these are here in the striatum, exercise, amphibians, hypothalamus, neocortex, midbrain, medulla, and hippocampus. Let's talk about the first drug that we take to in Parkinson, that is the Parkinson because of the economy. But the problem is 95% of this particular drug is decarboxylated conditions. That means only 1 to 2% enter possibility, which is taken up, stored, and transmitted. Dopamine is not used because dopamine cannot so talking about the pharmacological action of beta or dopamine, let's say dopamine has obviously we are talking about it as a drug on the CNS. It was smart symptomatic improvement. Here, the first symptom is hypokinesia followed by activity, and then there are secondary symptoms that are here, which include posture, gait, handwriting, speech, facial expression, mood, self-care, interest in life, and it leads to a general alerting responsibility. And to go to the other extreme, we can also include time cycles. In the cardiovascular system, for the tachycardia and pushing hypertension, whereas in the female particular zone, outside the blood-brain barrier, secondary, usually nausea and vomiting. In the endocrine, obviously, it is a prolactin inhibiting hormone, with the prolactin increase and increases the release of those hormones. Talking about the pharmacokinetic parameters of the pharmacokinetic parameters of levodopa are that is obviously everyone in the liver because therefore it has slowed the gastric empty. It amino acids decreases absorption, which are the high phosphorus metabolism and the adverse effects or adverse events associated with levodopa are intent, aversion, and development. So there could be two set of adverse events. One is it starts at the initiation of therapy, the other one is after prolonged therapy. So at the initiation of therapy, patients have vomiting, the zone in the CVS for social hypertension, cardiac so it will practically exacerbate angina and after prolonged therapy, we are talking about signs are possible, but we need to abnormal movement because facial tics, the nascent kind movement, and which will be taken care by reducing the dose, phenotypes, which will be mild anxiety, fears, depression, signs and possible. There will be fluctuation in focus performance that is kind of deterioration which happens after therapy, which is on or off effect or done response. There are certain questions that we taken here. Should not be given therapies, should not be given skin heart disease. We just talked about it for the social hypertension, tachycardia, exacerbates angina. It would not be given in cerebrovascular accident. It should not be given in psychiatric patients for the treatment, psychosis. Similarly, nothing given hepatic anemia will be peptic ulcer plus or minus. So, a lot of interactions can occur. First one is pyridoxine, the part of primary complex. Pyridoxine is a cofactor which converts dopamine in the presence of the enzyme dopamine dialloxylase in the periferation. That's not dopamine. That's not people. Okay. If you are given with antipsychotic drug, the dopamine antagonist, typical antipsychotic drugs such as phenothiazine or claroquinone, and anti-emetic drugs such as methamphetamine, the dopamine antagonist, right? People called non-selective MAO inhibitors. It can interact with non-selective MAO inhibitors for the hypertension crisis. In the with antihypertensive, it could actually make the hypertension, and when we give combined it with anticonvulsant effect, and we give antiparkinsonian, right? And we mean tremor is one of the symptoms that is taken care by the antiparkinsonian drug. Now, moving beyond this to the next class of drugs that is particular better. So as the name suggests, the drugs that tend to inhibit enzyme peripheral oxygen in the face. So levodopa plus carbidopa, whatever two. So if you look into this picture, now one of the things will be here. Look at the tools out here. Look at what is happening out here. 100% will be here. Majority of these fluids is metabolized. That some of it is metabolized in the toxicity and what is people way. But once you combine it with the part, this prevents the conversion of L-dopa dopamine benefic oxidase significant. So the amount of glucose that is changed, but still 30% of this particular metabolite is fat, 50% is possible of toxicity, and the major chunk that is 10% which is the. So what is the utility of lysozyme decarboxylase inhibitors? We talk about carbidopa and talk about benzoceride. So these are extracellular dopa decarboxylase inhibitors. It works across the blood-brain barrier, and so they inhibit the peripheral conversion of carbidopa. The plasma half-life of the long, the dose is used, systemic concentration of dopamine is used, pyridoxine because of the contact almost is minimized, and there are certain problems that are not resolved that is related to the CNS or more of the CNS, so it does not take care of the involuntary movement, no changes in the behavioral normality at all. So this was particularly in combination of two parameters to attend for 25 given combination of 100 available. Then we have another class of drugs that is the dopaminergic agonist drug, which act on the tricycle dopamine receptors and they can even in advanced they are correct. I told you about two derivatives of dopaminergic agonist, one is anchor, the other non-anchor derivatives. So bromocriptine is the anchor derivative, the potent agonist and one partial agonist. Improvement across 5 hours and last 10 hours, higher, it's a higher, higher associated with side effects, vomiting, hallucination, hypertension, mostly to alpha problem. It is given in late disease as a supplement, 1.25 twice daily, and it is end of disease and effect. Pergolide is another drug which is can find more suitable for but the efficacy and role is similar. Pyribalin is an epinephrine like few more drugs we have non-metabolic are propinerol and peptidazole. They are supplementary drugs against supplementary adverse effects are homocysteine, those radiation required, they can monotherapy, and they can also symptomatic like lesser dyskinesia and confusion. They are rapidly involved and metabolized. The adverse effects, nausea, dizziness, and motion tension. We go to the next category of drugs that is the MAO inhibitors. So MAO is degradation of norepinephrine and dopamine and epinephrine. So now it is going to use for degradation of norepinephrine and serotonin. There are more inhibitor is used for degradation of dopamine. The Salicylic is a selective inhibitor, and in low doses, it prevents the intracerebral degradation of dopamine. So high doses can hypertension have wide antiparkinsonian action in early cases. It can prolong the action, attenuate motor fluctuation, decrease wearing off, and early therapy might be the the adverse effects are positive hypertension, nausea, consumption, and acceleration of the dopamine. It's contraindicated with conversions, and it should not be given with which is fantastic as excitement, rigidity, hypertension, and depression. Moving to the next category of drugs, that is the catabolic or methyl transferase, because they are in dopamine. So these are selective, potent, and reversible from the amine and particles. They belong to half-life of large fraction process of pain and these drugs offer spectrum. So what it will do, it will take care of the one-off effect. It will reduce the activity of the breathing and allow the what we do. It could lead to worsening of the effects, diarrhea and yellow doing. Compound has been associated with treatment and the next category of drug is dopamine facilitators. We talk about amenity now categorized as an antihistamine. It acts rapidly, it has low efficacy, but increase and efficacy, mainly for binder and stop. For insomnia, dizziness, and hallucination. Then we talk about center antibody drugs. I thought the best drug for the tremors. These drugs are cost 10 to 25% the clinical features which last for 8 hours. Tremors are benefited more than any other symptom. Like we talk about levodopa has many improvement of all these symptoms, combined symptoms because drug and tremors benefit. Advantages are with the drug is cheap, has lesser side effects, it will be used alone for the competition. Levodopa for and probably for drug Parkinsonism. Trihexyphenidyl by far the most common central for the drug. Coming to the concluding part of Parkinsonism, let's have some things very clear. The first point is none of these drugs can adequately origin. Most of these, for mild cases, we take efficiently and converted drugs therapy. Standard therapies, levodopa plus carbidopa, the benefit of which lasts for 3 years. Subsequently, levodopa the combination of evapoxylase in the early perceiving advanced cases are mainly combination, the combination the pulmonary capability, weak inhibitors or inhibitors, and the most common cause of death in patients with Parkinsonism is due to either chest infection, respiratory tract infection, or pulmonary error. So with this, I conclude my presentation on Parkinsonism, and I hope I will give some insight into this particular aspect. Hope you have done any queries, please be right with them. Happy learning. Have a great day.